8th day of November. I trust you're doing fine from wherever you are watching us from. This is Mwangaza 4 p.m. Briefs, and my name is Daisy Paul, and I welcome you to this short program. Now, Deputy Speaker of the National Assembly Gladys Bos-Sholei has alleged that she has received death threats from individuals she claims are the root cause of the rising cancer cases in the country. And speaking during the launch of a new Moi Teaching and Referral Hospital at Kiplombe, Sholei said that the widespread use of harmful pesticides, some of which she claimed have been banned in Europe and the United States, is a key factor contributing to the increased number of cancer patients in Kenya.
That I've been a champion against harmful pesticides that we are using in our farms that is causing cancer. We know that it is causing cancer. It happened in America. That we are selling, but they manufacture it in America, they manufacture it in Europe, but they don't use it in their countries, but they bring it into Kenya, and we are using it. So if we are going to say we are going to deal with healthcare, let us not only deal with treating people, let us also prevent it. We know what is causing cancer. Kirinyaga County has the highest prevalence of cancer in Kenya, but Kirinyaga County also has the highest use of the harmful pesticides. It is only 267. I have brought a petition to Parliament. We have instructed the Pest Products Control Board. They won't listen because they are in bed with the pesticide companies, the agrochemical companies. I have received death threats from them. We must refuse to have those products in our country, because there is no point building a hospital and we are still making our people get cancer. Especially here, we are a farming country in Uasin Gishu. Please help us with that.
Kakamega County health officials have urged expectant mothers to seek antenatal care services early to prevent maternal deaths and reduce cases of premature births. According to the health authorities in the county, many premature births are linked to delays in attending the first antenatal clinic visits. Despite this, the county has recorded a drop in premature birth rates from 26 per 1,000 births to 20 per 1,000 births.
Mothers, they are underage, they are below 18 years, and therefore it's a challenge for them to get an ID when they are underage. But we are advising them when they get to 18 years, they should get an ID and have birth certificate so that they are able to register for SHA, so that they can, when they come to the hospital, when they are sick, when they come to deliver, they are able to get certificates from SHA. Unfortunately, most of them don't have IDs, and that's the challenge. But we are also advising our parents, our mothers. Some of them also don't have IDs, yet they are of mature age. So we want all our mothers to get identity cards, and then also get their birth certificate so that they are registered to SHA, so that they are able to get services from SHA.
All mothers, men, and even those eligible to get SHA, to register on SHA and pay their premiums according to what our community health promoters or what the SHA office, when they visit, give them as their rates. And therefore, we are also giving free services in all our outpatient level 2, level 3. Why we are getting these mortalities is our mothers are coming when it is late. They are not starting the antenatal clinic early, and therefore we want to encourage community health promoters to strengthen house-to-house visits so that they can do early referral. As a county government, Kakamega County newborn unit is one of the best NBUs in this country. In our kangaroo mother care unit, we have not lost any preterm for the last 4 years. We have also intensified that because County General Hospital can be overwhelmed, so we are decentralizing newborn services.
The government has established a 14-member committee to manage the relocation of residents from Isulu and Bushiangala, a move aimed at paving way for gold mining activities by the government-approved investor. And speaking during a visit in Lidambitsa gold processing plant, government spokesperson Isaac Mwaura assured residents that the Ministry of Mines would ensure no one loses their property. He emphasized that all affected families would receive full compensation.
And that gold will be processed here in this facility, that gold is going to benefit the local communities. And it will also help us to improve on our gold reserves, because when you talk about reserves at the central bank, they're actually based on gold. So it's going to really increase our revenue base, our currency strength, which is currently at 129 to the dollar, but also ensure that there are roads, schools, hospitals that are built in this beautiful area of Ikolomani. The community's 10% share is managed through the government systems. Under public finance laws, it is not directly given by the community, by the company. The company is not going to dish the 10%. It is done through the various government structures. 70% national government, 20% the county government of Kakamega, for example, and then 10% for community. But also there's another 1% share that I'm going to speak about now. It's called Community Development Agreement, CDA. There is already a team that is being put in place as we speak. I've just spoken to the PS for mining, PS Harry Kimtai. So people need not to worry. The government is on top of this, and nobody shall be dispossessed. Nobody shall lose their property. They shall be adequately compensated as per what shall be agreed upon by the team that the Ministry of Mining, under the State Department for Mining, is doing.
With that, we come to the end of this program. Many thanks for staying with us. I'll see you again at 9 p.m.